Hello, everyone. Welcome to the latest edition of Dementia Talks Canada, How to Improve Dementia Support in 2023. Each month, Dementia Talks, a series presented by the Alzheimer Society of Canada in partnership with Brain Canada, features a conversation on a topic related to dementia involving researchers and people who have direct firsthand experience. My name is Sabina Antonescu. I'm a Senior Program Manager at Brain Canada, and I will be moderating today's talk. I would like to extend a sincere thank you to you all for taking the time to join us today for this meaningful conversation on improving dementia support. A few housekeeping items before we start. The session is being offered in both English and French. To select a language, you can click on the interpretation button at the bottom of your screen and then choose the English or French language. You will also notice that poll questions will occasionally pop up on your screen throughout the session, and we ask that you answer those whenever possible to help us improve this series in the future. The session is being recorded, but please note that only the video and audio of the panelists and myself as the moderator is being captured in the recording. Lastly, we will have a question and answer period towards the end of the hour. Questions can be sent to our panelists through the Q&A feature on your Zoom control panel at any time. And any questions that can't be discussed live will be answered later over email by staff of the Alzheimer Society of Canada. Before we get started, I want to acknowledge that the offices of Brain Canada Foundation are located on the traditional, ancestral, and ceded territory of the Kanien'kehá:ka peoples, a place which has long served as a site of meeting and exchange amongst nations. We honor and pay respect to elders, past, present, and emerging, and dedicate ourselves to moving forward in the spirit of partnership, collaboration, and reconciliation. In our work, we focus our efforts on the Truth and Reconciliation Commission's calls to action, numbers 19 to 24, that pertain to improving health for Indigenous peoples, and on number 57, that focuses on advancing our own learning on Indigenous issues. Our team are sharing a link to all of the calls to action in the chat right now, and we urge you to take a look. As previously mentioned, the topic of today's talk is how to improve dementia support in 2023, and I'm honored to be joined by 5 individuals who bring unique perspectives and knowledge on this topic. Joining us today, we have Dr. Lillian Hung. Lillian is Assistant Professor at the University of British Columbia School of Nursing, clinician scientist at the Vancouver Coastal Health Research Institute, and founder of the Innovation in Dementia and Aging Lab at the University of British Columbia. Lillian is interested in patient-oriented research and the innovation of care for those living with dementia and their caregivers. Welcome, Lillian. Thank you for being here with us today. Next, we have Busola Adekoya. Busola is a registered nurse and a PhD candidate in the School of Public Health Sciences at the University of Waterloo. Busola is passionate about the rights of persons living with dementia to receive quality care, and her research focuses on persons living with dementia at risk of going missing and promoting safe walking. Thank you for being here today, Busola. We have Sybil Braganza. Sybil is coordinator of the Ethnocultural Seniors Project at the Social Planning Council of Ottawa. In her work, Sybil collaborates with several community groups to create, distribute, and assess new multilingual and culturally appropriate brain health resources and programs. Thank you for joining us today, Sybil. Next, we have Catherine McPherson. Catherine is a self-described sandwich generation caregiver in Montreal, looking after her 3 children while attempting to care for her aging parents from a distance. Her father in Nova Scotia is a primary caregiver to her mother, diagnosed with Alzheimer's and also living in Nova Scotia. Thank you for being here, Catherine.
Thanks, Sabina.
Last but not least, we have Melody Neufeld. Melody is Client Services Team Manager for Central and Northern Saskatchewan at the Alzheimer Society of Saskatchewan. She works to support persons with dementia and their families as their dementia journey unfolds. Welcome, Melody, and thanks for being here today. If you want to find out more about our panelists, please visit the link that our team has posted in the chat. All right, so let's get started. To kick off our discussion today, I would like to ask each of our panelists if they could share their top recommendation for improving dementia support in Canada in 2023. And Sybil, if it's all right with you, I'd like to call on you to start us off.
Sure, thank you, Sabina. I'd like to begin by acknowledging that Ottawa is located on unceded territory of the Algonquin Anishinaabe Nation. So from my perspective and looking at the challenges we face at the ground level, I think the first priority is education and increasing knowledge about dementia, especially for ethnocultural seniors. For many of the groups and the seniors I work with have no knowledge of dementia, and they usually attribute it to old age or something that they have done in the past that they're not too happy about. So I think education is very important, and it should focus not only on seniors, but also with family members. The second is improving accessibility for mainstream service for ethnocultural seniors. So having the knowledge and the education is one step, but we also have to make sure that ethnocultural seniors are accessing the resources so that there is a diagnosis made and they know when to get support. And I believe this can be achieved easily by working with the communities, because the ethnocultural communities really know the needs of their community, and also with faith groups. So there is a lot of outreach to be done. And the third is at the policy level, establishing more humane and sustainable models of care in Canada. So we pilot and scale models that are successful, and then have those models sustainable for success. Given that we're going through a healthcare crisis, I think we need to really empower the community, and especially within my work for ethnocultural communities, so that those that are most marginalized do not fall within the cracks. So those are my top 3 priorities.
Thank you very much, Sybil, for sharing those with us. And I'll come back to you in a bit to talk a little bit more about your work with the Social Planning Council of Ottawa. Maybe up next, Lillian, could I ask you to share your thoughts as well?
Yeah, thank you. I really agree with what Sybil talked about. It's so important about public education and access and at the policy level. Thank you for that. For me,
sorry, is it just on my end, Lillian's mic? No, Lillian, that we're having a hard time hearing you. I think your mic is a bit muffled.
Oh, is it better this way?
No.
No? Maybe it was okay before. It's not working right now. I just switched computer. So you want to talk to the panelists and let me switch computer. I'll come back in a minute.
Okay, no problem. We'll move on to the next panelist. So maybe in that case, Busola, what would be your top recommendation for improving dementia support in Canada in 2023?
Thank you so much, Sabina. That's a big question, because I think Canada should be doing more. But let me start by saying community support. So I'm talking about creating dementia-friendly and inclusive communities. According to the 2022 National Dementia Strategy Annual Report, we know that some ethnic and cultural communities, they are likely to be at higher risk for developing dementia. So for example, let's look at the Indigenous communities. The prevalence of dementia is 34% higher than the general Canadian population. And we know this is due to associated chronic conditions such as hypertension, obesity, sometimes it can be smoking or diabetes. And also when we look at the term dementia itself, it's not often used among the Indigenous communities. They use symptoms associated with dementia to describe dementia. So we need to kind of consider this, because instead of using these words, this can be a contributing factor to them accessing the support and services that they need for dementia, especially in the early stages of dementia. And it can also contribute to their lack of participation in dementia-related projects. So therefore, my recommendation would be incorporating cultural traditions to help people living with dementia from diverse cultures, so that they feel comfortable to seek out support and services. And in addition, we need more, I know we're doing this, but we need more culturally appropriate and culturally safe dementia guidance related to treatment and management. I've heard from care partners that sometimes they don't receive this information until not right after diagnosis. And I think we should be giving this support and services and host dementia guidance to them, like right after the diagnosis of a loved one with dementia. So basically, I'm saying there's a need to address the barrier here, the barriers to equitable care, such as unequal access to health services, higher risks for certain chronic conditions, as well as limited resources being printed in their own first languages. And when we're talking about support and programs too, we should not forget care partners or families or friends living with dementia. I was reading the World Health Organization reports in 2009. We know about 1 in 5 family members, as well as care partners or friends, they reported that they spend an average of 5 hours caring caring for their loved ones. So you can imagine this can be like really overwhelming for many people. I'm talking about emotionally and even feeling isolated. For some people, they feel isolated. And if you think of what this impacts, the outcomes might be, it can lead to a higher rates of developing anxiety, depression. And if you think of the sandwich generation, so these are the people caring for their aging parents, and they also have younger children, for example, maybe caring for children under age 18. And this can be like really overwhelming for them. So they need the support and services. So we need to improve that. And we need to develop sources for persons living with dementia during climate change related emergencies. I will talk a little bit more about my research because I'm looking at alert systems for missing persons with dementia, especially if they go missing during the cold weather or very extreme hot weather that can actually affect them. And a big part of it that I know Sybil has already talked about is the education is so important. Stigma reduction. Stigma is still there. Stigma can come from inaccurate, assumption about the persons living with dementia, their capacity, what they can do, what they cannot do. And we know dementia is a taboo topic in some Asian countries and even in African communities because I'm of African descent and I can say that. So stigma itself is a risk factor for developing dementia, especially for people going missing. And also for their social circles, the family members, they might not be able to ask questions because of that taboo. They don't know, are we supposed to talk about dementia? What are we supposed to say? When are we supposed to say this? So we need education regarding that. And it's really, surprising to find out that negative stereotypes about dementia are common among healthcare professionals. If you go back to the 2022 National Dementia Report, they actually mentioned that here. So when we're talking about public education in reducing stigma, we also need to remember appropriate training for healthcare professionals so that we can all address stigma related to dementia. And also, how do we interact with persons living with dementia? If you see someone living with dementia or you think they need help, how do you interact with them? How do you communicate with them? And I think this is really important. So overall, yeah, public education is important, as well as training for healthcare providers and also healthcare professionals. And yes, we need community supports.
Thank you so much, Basola. Really great points and a lot of stuff that we can dig into a little bit later. So thank you for sharing your insight there. Lillian, do you want to go next? How's your mic? No, or I'm unable to hear you.
Oh, that is strange.
Oh, there we go. That's perfect.
It's okay? All right.
Yes, thank you.
Oh, thank goodness, technology. And I would tag along about like stigmas. And I think there's a lot of stigma and assumptions about people with dementia, like people associated with dementia, their caregivers, and people also like care for people with dementia, like staff and long-term care. So I would say we need really look at dementia and how we can increase the capacity of supporting people living with dementia and people who care for people with dementia. Innovation is really, really key because we need to focus on things that works and what works. Like as a country in Canada, we can be the leader leading this work. And, and I also think that when we do research or when we do projects and when we make investment about how we support or creating the support, really, we always need to think about like the real life impact. So if there's I know there's a lot of great ideas in the community, and people also have assumptions about like how people with dementia can contribute, or assumptions about, frontline staff that they're so busy and they might not have, capacity to help. But it's really, really, really important to work with the person with lived experience, the person living with dementia, because no one can fully understand dementia except the person who actually living with the disease. And it's really, really important to work with the caregivers and informal caregivers and the formal caregivers. So when we do innovations, we need to find ways and support and encourage. I know that, there's some countries that are a lot more progressive about making sure that, like the PPI, the patient and public engagement in Australia, in UK, that they make funding application that it's mandatory, that you must include the person with dementia as a partner or family caregivers. So I can see that we are moving toward patient-oriented research in this country. We're working towards that, but I think we have a lot to catch up. So I think if we wanted to make a difference, to accelerate, I think really focus on innovations. And if I have a chance, I could talk about, when I mean innovations, there's concepts about like incubations and how can we bring those great ideas that people have in the community that we know that works, but they need support to make them to turn into real life impact. So how we can better support those great ideas either from the startup or from people living in the community that they have that, and how we can better support accelerations once we have those ideas, and how we can also make it into a viable business model so it can actually bring real life impact to people. Implementation science, I think these are really important things that would make a difference. Yeah. So I'm going to stop here.
Thanks so much, Lillian. And we'll definitely come back to you to hear more kind of about the work that your lab is doing, the IDEA Lab. Catherine, can I ask you to share what your top recommendation would be for improving dementia support?
Sure. Yes. Thanks, Sabina. I do, listening to the other presenters, I do feel like a lot of my concerns and priorities dovetail nicely, certainly with what Busola and Sybil have said, and Dr. Hung as well. As a caregiver at a distance, I've often, sometimes find it's a bit hard to access or track down different information, whether it be about home care options, whether it be where to get support. As a caregiver, my father's the primary caregiver. And I just, it sort of struck me the other day, wouldn't it be great if there was, and there are many great resources out there, particularly on the Alzheimer Society websites. But it would just be wonderful if there was sort of information all in one place, a bit of a playbook for caregivers, so to speak. Because caregivers, I see this particularly with my father, he's often too busy or too exhausted to sort of track down information, process things that are thrown at him. We've cobbled together a lot of our information and resources from talking to other friends, other family who are on their own dementia journey. Maybe the pharmacist will sort of feed in a bit of information. It's sort of, you never know where you're going to get the help and support and tips as you go along and try to support your loved one. And it would just be I think having education really is key, and education particularly for the caregivers, since and the family members, since they do end up doing they're on the journey with their loved one. They're the ones who are really sort of the primary supports, maintaining the health of their loved one as best they can. And I sort of remember when I was pregnant with my first child and I went into the hospital, I was presented with this book akin to what to expect when you're expecting. And, you sort of get all this information. Well, you need to, check this off. And as you progress, you're going to, encounter this and make sure you're seeing your nutritionist and think about that. And I'm like, I feel like that's exactly what I would love to have to best help my mom, to be like, okay, well, when I want to find out about the best nutrition for her, or, would it be great to call in an occupational therapist at this point? And just to have that all in one place, and again, also what to expect, like as her dementia progresses, well, now you may want to consider bringing in this team member to talk to, but also really, and I guess so definitely kind of an all-in-one sort of a guidebook would be really helpful as a caregiver, and particularly someone at a distance who isn't there on the ground all the time, but can maybe sort of fill in the gaps for my father, who is doing the primary caregiving. And that sort of then kind of would be great if it was also backed up with the sort of team approach. And now whether it was the if the person living with dementia is fortunate enough to have a primary caregiver or a geriatrician that would present them with this sort of playbook, or like, here we're now on this journey. Here's what you can expect. Here's how it's going to roll. And kind of get, again, sort of talk to like team members, but now, if you have a family member who's going to be your primary caregiver, what sort of supports do they need? And this is where they can get it. You might bring in, as I say, like a physiotherapists, nutritionists, other counselors, grief support along the way. And one of the, I've attended a few caregiver support groups via Zoom through the Alzheimer Society of Nova Scotia, and they've been very, very helpful. And during one of their sessions, they brought in a behavior resource consultant, and she was absolutely fabulous. And she just had a lot of wonderful advice as to sort of how to understand the responsive behaviors in the person living with dementia, how to better respond to their needs. I just gained so many insights into how I could at least advise my father, and then he could better and advise our home care. We have some home care help for my mother, and sort of advise them as to how to better respond to her needs in any given moment. And so that really, I guess, like maybe another priority would be, again, considering behavior, sort of responding to behaviors, really client-centered care. So again, as sort of both Sybil and Bussola spoke to, considering the person's background, I mean, where are they coming from? And then also, more unique to that individual still, their personalities, their likes and dislikes, and really tailoring the care they receive to, if they're a shy person, well, then maybe they don't need a lot of day programs or socialization or interaction. Maybe they played a lot of music earlier in life. So that's a way to calm them if they're, if they're seemingly unhappy, or you're trying to figure out how to best respond to their needs in any given moment. So really a focus on that sort of client-centered care, and but again, mostly educating the caregivers as to how to best go about that, and making them feel supported with kind of a one-stop shop for resources, or that they know they have a team, or at least they know who to go to support them in any given moment. And then maybe that team also preemptively comes to them. I mean, that would be a dream.
Thank you, Catherine, for sharing your experience with us. And one of the things that struck me when you were talking about this playbook was really the timing of it, and really ensuring that you have that from the beginning, and that it's able, before you go on this journey, that you have these resources and you know where to turn to, and the timing of it is really important, having that at your fingertips.
Yeah,
so-
I found those, we're always sort of a few steps behind. It's like, oh, if only I'd known that
Right.
a few months prior, we could have, sort of smooth things out a bit as we go along, and learn as we go along.
Right. Thank you.
Thanks.
Melody, would you like to share what your top recommendation would be?
For sure. So I think, I'm going to specifically zero in on First Link, which is one of the main support sections of the Alzheimer Society. So the generation of long-term sustainable funding for First Link from the federal government and major donors, which can be shared across the country, I think is certainly a priority. So the Alzheimer Society focuses on creating and building that community of support, rich in information, services, and experience. And we help create connections, provide services that people can turn to and tap into when needed. And we're a place to go to not as a last resort, but as a first step. So the First Link program is a free program of the Alzheimer Society that connects people with dementia and their care partners to that community of support. And our First Link coordinators provide ongoing information, support, and education as early as possible and throughout the progression of the disease, and empower individuals to identify options that make their unique needs, meet their unique needs, and to live well with dementia. So you don't need a formal diagnosis to be connected with us, but it has been shown with direct referrals from a healthcare professional or community agency that those who are referred in that way are connected at an average of 11 months sooner.
Melody?
To Alzheimer's Society. Yeah.
Apologies for interrupting you. There's a bit of an echo when you're speaking. Do you have headphones that you could maybe put on, or just the mic in a way? There seems to be an echo.
You want me to get them right now? Yeah. It would take me a sec to find them. Do you want me to do that now?
Melody, can you just mute and unmute really quickly so that maybe we can reestablish the connection?
Is that better? Is that better?
No, so we can give you a few minutes to find some headphones or maybe disconnect and reconnect, whatever works. In the meantime, we can continue with the discussion and then we'll have you jump back on to talk about the First Link program. How does that sound? Okay, great. So I might follow up on some of the points that you all raised in terms of what the top priority should be for improving dementia support. Maybe I'll start with Lillian. Your lab at UBC is doing some very interesting work to create innovative solutions that are relevant and meaningful for individuals that are living with dementia as well as their caregivers. Would you be able to share some examples of solutions or technologies such as the What Matters app that your lab has developed that already exist or perhaps are in development?
And I'm happy to talk about the What Matters apps. That probably would relate to what Catherine talked about, that like something that could actually help the caregivers to support the person living with dementia. So when we developed the What Matters app, we worked with people living with dementia, so patient partner and caregiver partners and family partners. And I also we work with a team of frontline staff, that they are care aides and they're nurses and social workers, and they are in acute hospital caring for people that they are kind of, when you're being put in the hospital, it's kind of like a very distressful situations. It can be very hard for people with dementia to make sense about what's going on and why I have to be like staying here, not at my home with my family. So the app was developed to support people who are in these in the care setting. And so we asked, the app allows the family who knows the person the best and work with the person to create a playlist of things that would help the person when they are feeling stress or anxiety, or if they need support that will actually meaningfully that could comfort them. So it could be a family videos, very short family video with a message, and the family could tell them that mom, it's okay, you're in the hospital, that you had a wound at your back, or your hand's broken, that you require surgery, and I'll be there to see you, like on Wednesday, or so on and so forth. So a really short family video, or it could be a song that that when your father is upset, that song always comfort him. So it could be a song. It could be some kind of images or photos that really that will comfort the person. It could be like grandchildren, babies, of grandchildren's. So what we wanted to do, because we heard from the staff said that in the acute care setting and in long-term care, they need something that's very, very simple and very easy to use. So the app will allow them just click, they find the person, and then they click and the resources will be there. So the problem with the traditional care plan is, like, when we heard from the staff, like if you have the paper care plan, and people could know that, okay, if this person listens to the alpha song, then it will calm him down, but there's no ways for the staff, the nurse have to find time to find that song. But with the app, the nurse could just go to that person and click, and the family already uploaded the song, and they just can play the song, and the song can be delivered. So it's meaningful resources, it's easy to access, and it's meaningful because it comes from the family. It also put the family into the active care partners, so that allow them to actively help the person. Yeah, so that's but we did like a whole bunch of different technology work. But when we all do this work, when we develop new products, and we always think about working closely with the person living with the disease, and also working closely with the caregivers and the users. Like in our case, would be the staff, because if we don't understand what will help the staff to use the app, it could be a very beautiful, very good app, but if the staff do not use it, it's not going to be useful. So in order to make something that's useful, that's usable, so, and we'll always go back to the point that, always challenge the assumptions, that find ways to work with all these stakeholders that they will be engaged to co-develop and co-design so that it will be relevant and meaningful for them. Yeah.
Thanks so much for sharing, Lillian. Very interesting work that you're doing and working on. Melody, would you like to address kind of the roundtable question that we had at the start?
Yes, can you hear me? Okay.
That's perfect. Thanks.
Okay, thank you. Sorry about that. Yeah, just a little continuation about First Link. So I'm just speaking from the province of Saskatchewan, but across the country, there are some differences in our programming, and there are foundational principles that we're following the First Link program connect with, and that's basically to help individuals, families, and care providers understand and prepare for the successes and challenges associated with the progression of the disease through practical knowledge and strategies. So evidence shows about the average 11 months sooner, and generation of a long-term sustainable funding for First Link will help to build sustainability and aid expansion of the program across the country. And it will make a statement in no uncertain terms that we are an important part of the circle of care of a person living with dementia and their care partners. Thank you.
Thank you, Melody. Maybe just to follow up on that, when we had met last week, you spoke about the First Link program as being a resource that can really empower individuals, connecting them to not only a wealth of knowledge, but a community of experts and support. And you shared an incredible example of how the First Link program was able to empower someone and ultimately improve kind of their quality of life. Would you mind sharing that example with the group?
It was an example that one of the First Link coordinators had shared with me. And basically it was about a client who was hesitant to connect with us. In fact, it was just too emotionally difficult. It was a care partner of someone who was diagnosed with young onset dementia. And he was very, he was trying to deal with all that went on with that diagnosis and with the person's decline, his partner's decline, and thought he would not be able to live without her. And so he did reach out and connect with us again. And through that, there was a connection with our First Link coordinators to one of our support groups. And one of our support groups is particularly for young onset spouses. And so after being in that group and having that support from the other participants, he did talk about having some hope and being able to take one day at a time and be present with his partner as the disease continues.
Thank you, Melody. Very powerful. Perhaps I'll go back to Sybil. So at the Social Planning Council of Ottawa, you collaborate with a diverse range of communities and in order to kind of expand resources available to ethnocultural seniors. So you had mentioned in order for these programs to be effective and sustainable, really important to seek input and advice from the community and really work alongside them. Can you speak about some examples of successful community-based programs for dementia support that have been implemented and maybe the ways that they have been adapted to ensure that they were culturally appropriate?
Sure, thank you, Sabina. So I work with the Social Planning Council. I work with about 30 different grassroots ethnocultural groups, and the SPCO provides, whenever we can, get funding, we provide micro grants to them. Currently, we have a number of ethnocultural leaders that have dementia programs that are running, and they're really very cultural specific that are offered to their seniors. And then that, because there's such a stigma, we introduce it as part of a social engagement, social cultural program so that they can make sense and then attend it. So our programs are very successful because they include the needs of the community. The leaders are very much involved. We have, for example, the Filipino seniors that incorporated a cooking class for one of their seniors that has dementia, and she took the lead to have the cooking class. And so very small, tangible things that they are able to do at a very basic ground level. But I also wanted to mention that within the 30 groups, we have so many volunteers. And one of our volunteers, and really the caregiving burden and the stress, one of our volunteers within the community supports 3 different seniors, and she provides over 1,200 hours of volunteer work. And that amounts to the system, if you look at the healthcare system, around 24,000 a year, which is on a volunteer basis. And what she does is she provides language interpretation. She takes them for groceries. She provides emotional support, daily phone calls, cooking meals, doing their groceries. So just a vast amount of services that she provides, this one senior. And this is not just one senior in our community. It goes over all of our groups that are supporting their seniors. So our programs are really built around supporting the needs of the seniors. And now how do we get them the support they need in their own language so that mainstream services have the capacity to provide cultural interpreters that not only can provide the medical information, but also take into understanding the cultural information. So I think that we have a long, long way to go, and our seniors are tired, they're burnt out, and they really need a lot of support, especially our caregivers. We did a study with Carleton University in 2018 on caregiver burden, and the results were not only around caregivers providing so much of informal support and not knowing what's available, but also having those language capacities, as well as accessing mainstream services that's left to so many gaps within the system. So that's, in a nutshell, kudos to the groups that I work with. They're amazing.
Absolutely. And I think when we had spoke last week, you'd really emphasize kind of how important it is to recognize and value the contribution of caregivers. And until you do that and recognize that, that is one of the steps towards improving dementia support. So thank you for speaking to that point.
You're welcome.
Busola, maybe I'll come to you next. So you're a registered nurse, as we mentioned at the top of the program, and you're currently in your PhD program studying ways to improve the safety of people living with dementia. Could you provide maybe some examples of policies and programs that have been implemented or could be implemented in order to create these safe, accessible environments that you had mentioned in your response previously?
Mm-hmm. Thank you so much. Like I mentioned, my own research focused on missing persons living with dementia. And so some of the policies for my thesis, I'm kind of looking at assistance for missing persons living with dementia. And I know I'm looking at the policy angle of it. So we need policies that focus on providing a safe environment for persons living with dementia. So, for example, I'm looking at what have been implemented in other countries. For example, Scotland, they have what we call Poker Alerts, which is an app that you can download. And if a person living with dementia goes missing within your vicinity or within a particular geographic area, you will receive an alert that a person has gone missing. And then you can go back. You can go and look at information about the person, physical descriptions of the person, the name, all the information that can help you to locate the person quickly. But you need, of course, support and funding from the government to be able to do that. So that's one way that the government we could involve the government in it, develop different policies around how do we make persons living with dementia safe, especially if they go missing. How can we find them quickly? Because the cost of locating a missing person is high. I can't really remember that on top of my head, but it's kind of over $2,000 for locating a missing persons living with dementia, involving the police and the search and rescue team and so on and so forth. So we need policies that will kind of be like a central streamline to what can we do if we want to develop assistance for missing persons living with dementia. It's kind of an ongoing discussion right now in Canada. I know we have a silver alerts common in the United States. I think all but 3 states have established silver alerts programs, but in Canada, we only have the BC silver alerts. That's all that we have. And I know there was a national petition in 2019 to the federal government about establishing silver alert programs for missing persons living with dementia. But we still need policies, like I said, that would look into what do provinces and territories, what do they need to do if they want to develop similar programs like that? So we don't have programs like that, like right now, or policies that will be guiding that. Another thing that I would like to talk on is housing, accessible and supportive housing for persons living with dementia. I did a report, I think that was last year, looking at housing, especially for older adults in general. But we still need policies, because we know housing can be really, really costly and really expensive, as we know. And housing, when you're looking at housing, it must meet the needs of people, especially older adults, persons living with dementia. We know needs change as people, as people grow. And also it depends on people with different disabilities. How do we support them? So we need policies around that to be able to be able to access all the support and the services that they need. But right now, we don't really have something concrete. We have some ongoing support and services, but these are still some of the issues that we need to look into.
Thank you, Vizol. That was very informative and very interesting work that you're doing in your PhD program. Catherine, I'll come back to you. When we spoke last week, you had shared a story about an experience that you had when you last visited your parents in Nova Scotia, where you kind of saw firsthand how the impact the constraints on the healthcare system can have on dementia care and support. Would you be able to speak to that a little bit, and why it's important to have clear guidelines and protocols in place to help support people living with dementia and their caregivers as well?
Yes, absolutely, Sabina. Yes. So I last visited my parents in early November. It was a pre-planned visit. But as it happened, a day before my arrival, my mother was admitted to emergency at the local hospital. There was a respiratory issue, which turned out to be blood clots, which was since addressed, and she's fine. She's back home now. When obviously, I think Lillian alluded a bit to this as well, when she found herself in hospital, obviously, why is she there? She doesn't understand why she's there. It was a very disorienting experience for her. And on the first day that I went in, and she spent about 3 days in a bed in emergency before she was able to be moved to the wards. Everyone knows the bed crisis in hospitals across Canada. But I came in and greeted her, and it was really lovely to spend all that time with her. And came in, and she had a glass of sort of half-finished glass of juice on her tray, and she said, "Oh dear, I'm finished with the juice. Would I just like a cup of water?" So I dumped out the juice and got her some water. And not 5 minutes later, somebody came in and they said, "Oh, did she finish her drink? It's time to go for her CT scan." So in fact, it had not been juice, but she had to take this in preparation for her scan. I said, "Oh, well, no, sorry, we threw it, we pitched it out." Anyway, it was fine. They brought in new liquids and she was able to take that. But I know they would, and in an emergency room, obviously they're quite pressed. They can't be by the bedside of every patient all the time. But it did make me think, what are the dementia protocols in place? If not in an emergency room, but at least on the wards or elsewhere in hospitals, because again, they would occasionally bring in medications, and she would not necessarily take them if you were not there to make sure that she would take it. And every night before I would leave, I would periodically throughout the day keep asking her, "Mom, do you remember if you need help to press the red button, the call button on the hospital bed?" Every time we go over this, and by the end of the day, maybe she'd be remembering, but I just knew in my heart of hearts, the moment I left, like, no, she would not remember to do that. So it really struck me that really a distinct dementia protocol is required in so many settings, and not just in healthcare, but in public security settings or in community life as well. we are very fortunate in that her hairdresser, for example, her own mother was a person living with dementia. So she's excellent when she does my mother's hair. She's, able to say, okay, well, now I'm going to, now we're going to put the warm water on, dear, and takes great care with her. And it's not, it's not an unpleasant experience at all. But yeah, I'm getting a clear idea of how it really need to tailor our approach to caring for persons living with dementia. And then also to what Sybil spoke to as well, sort of respite for caregivers, and to really help with the caregivers. When I was out visiting my parents and spent was the better part of a week with my mom in hospital, and my father had said, oh, well, why don't, we'll spell each other off, or we'll both go in. I said, no, Dad, why don't you stay home? I'm happy to go in. I'm happy to spend the time with Mom, talk to the doctors. And he slept for 3 to 4 days straight. He just stayed at the home and he just slept. And it's clear that it would really, they are the backbone of support for families, for everyone on this dementia journey. And they really, really need better respite available to them, whether it's in the form of, a brief 24, 48-hour living care that comes, on a one-off or an occasional basis. Or, we often talk about respite beds being available for patients. Well, maybe if respite beds are available for the caregivers and someone else is working with the person living with dementia, and the caregiver can simply take a couple of days to rest and recoup, because they make all the difference, and they are the best of all caregivers for sure, but they can't do it 24 hours a day, 7 days a week.
Thank you, Catherine. We really appreciate you speaking so openly and sharing with us kind of your experience with dementia support and what's needed and what's missing and what's really integral to improving dementia support in Canada. I want to thank all of our speakers for sharing their knowledge, their insights with us. I see that we have a few questions for our panelists. We will try to get to as many of them as possible, but as I mentioned, any questions that we are not able to cover live will be answered by the Alzheimer Society of Canada over email, provided that you've included your email address. So if I go to the first question, they say this panel is one of the best I have listened to. I agree, you guys are all fabulous, so thank you again for participating. I'm interested in whether any of the panelists are aware of jurisdictions that have incorporated art therapy, so active patient participation in all forms of arts and culture, as a social prescription or as a regular feature of caregiving and health management outcomes. They reference a link that they found on your website, Lillian, and they say that their question is about making art a regular prescription in dementia care. Is the medical community talking about this, researching this? Give it to the panel. Maybe Lillian, if you want to start.
Those are great ideas, but I really say it's not enough. And medical professional, they don't necessarily know the resources. So if they don't know, the GP do not know, and they would not make the referral. And that's really not enough in the community. And there's hardly any that are culturally sensitive, especially some of the minority. Yeah. So, this is a huge opportunity to build more for the diverse, group, that racial populations. And there's so many things that can be done, and these are not very costly. And there's a ton of community partners that would love to do this if they have the right support. Yeah. So, yeah, there's so many levels that more can be done. Yeah.
Can I quickly jump in, Sabine?
Of course.
Okay.
Yes.
So I've heard of some dementia day programs that have incorporated art, but I'm not sure, maybe in Canada, but it's something that can be done. So this is Alzheimer Society. I'm kind of just throwing it out there for some day programs. I think some activities can actually be incorporated into day programs. Like I said, I can't really think of any right here in Canada, but there are some different research studies that have looked into art therapy and how you can actually incorporate that. And one of the things that I've read is incorporating it during day programs for persons living with dementia and their care partners. Hopefully that helps.
Sorry, I just wanted to add that at least on the grassroots level and the community level, we don't look at it as therapy. So they are doing art, like we have an Afghani group. It's not a dementia group, but they are doing art classes. And like I said, when we have any of our programming, whether it be art or coloring Mandela books, or it's an extension of the regular programming and activities our cultural groups are doing. And we don't ever call it dementia. We call it like mind boosters or mind programs or healthy mind. And we're trying to stay away from the word dementia because it's such a stigma. And when we incorporate it into our regular programming, cultural, recreational activities, we find that we get more of the community input that they want to take part in. They're bringing their loved ones, and the caregivers are also attending. So we have combined caregivers as well as the seniors that may have early signs of dementia and the support. So I think art and exercise is very much integrated into many of our programmings for the many different 30 grassroots groups.
Thank you all. Anybody else? We have one more question, but if Catherine or Melody, you'd like to chime in? No?
I mean, I do. I think it's a wonderful idea. And again, it kind of goes back to the idea of the client-centered care. So if the art therapy is going to bring out the best in the person, is going to, you know, sort of open a window to is to find a way to keep connecting with their loved one, then I mean, the sort of more holistic approach to care. I think that it's the best, the best route to take, and the more that can happen, great.
Thank you. So we have a couple more minutes. Maybe we'll just go to the next and final question. Could you discuss the connection or coordination or lack thereof between being a community patient versus inpatient, so hospital stay, for getting on lists for long-term care facilities, such as loft referrals, as running into a situation who is responsible for care? Anybody on the panel? This is the question for David in the chat, if you want to have a look.
I can only speak briefly to my experience. I think it varies from province to province. You know, that's been sort of one of our challenges as well, is to find out, in our case, it's within Nova Scotia, who manages the long-term care wait lists, and public care versus private care. Are all beds in long-term care managed by publicly? I know Nova Scotia currently at the moment, no one is accepted into long-term care except direct from the hospital. We're very fortunate. We have a care coordinator through Continuing Care Nova Scotia who will come and continually assess my mother and to help make recommendations about you know, any other, you know, interventions or further supports that she could use, whether it was, you know, visit from a occupational therapist, etc. But I guess really all I can say is that I know it's really depends on how things are managed at a provincial level, and I can simply say that is one of the challenges, is trying to learn how all the different systems work. And you know, I spoke with a friend in Ontario, and it does seem to run a bit differently there. So that would also be a place where there is more room for improvement, just to have it a bit more clear for the families, you know, as long-term care planning is done, whether it's initially through home care or home supports, who is responsible for that? Who do you talk to? How does that all roll? But I know it does vary differently across Canada.
I just wanted to jump in about long-term care. We've just done a focus group with our ethnocultural groups about housing. And ethnocultural groups, that's the last resort for long-term care, specifically that they're not culturally appropriate. If they're a vegetarian, there's no support for that. It's just the whole cultural, the religious, the social aspect of long-term care is not built into the current system. So again, another caregiver burden that falls on the family that have to take care of their loved ones without no support. So I just wanted to say that we've got a long way to bring in supports for culturally appropriate care in every factor of the healthcare system. Thank you.
Thank you.
Add that
Yep.
I think there's still a lot of stigma and assumptions about what the person with living with dementia can contribute to that decision making. And most of the time, inpatients are not consulted, and they are just being placed. And there's a lot of variations from province to province, and also from hospital to hospital, and also depends on who are dealing with the placement. And I know that with the surge of beds in acute hospitals, and people often just being placed, and there's not they don't have the time or allowed to have that conversation to find what would work for that person. The person feels very much that they're excluded from that decision making and never been consulted and just being moved to another place. I don't know. I just think that's not right. There's not so much more we can do about this. Yeah.
Absolutely. Still a lot of work to be done for sure. And we'll wrap up the Q&A. I did also just want to acknowledge and thank Guy, who had put in a comment about the importance of having these support groups for men caregivers as well, and kind of the stigma that can sometimes come with that. So thank you very much. And I know Leah had answered in the chat, but I just wanted to acknowledge that question. So with that, thank you once again to the panelists and the viewers for your participation in today's talk. The recording of this session will be posted to the Alzheimer Society of Canada's YouTube channel in the coming days, and Brain Canada will include a link to the recording in its monthly newsletter, Brain News. Please make sure to join us for the next talks in February and March. We have some exciting topics and developments, so make sure to bookmark alzheimer.ca/talks to stay informed. And with that, I wish you all a great rest of your Wednesday, and really thank you once again for joining us today. And thank you again to the speakers. Really appreciate your time.